Imagine a device that could free you from dozens of painful finger pricks every single day. One that gives you a constant, real-time picture of what's happening inside your body. For millions of people, this isn't science fiction. It's a reality. But what happens when that life-changing technology is also a life-threatening gamble? Today, we're digging into the situation in South Africa, looking at this fight for both access to and the accuracy of continuous glucose monitors.
Okay, let's just start with a number. 4 million. That's like the entire population of a major city. It's also how many people in South Africa are living with diabetes. So this is not some niche problem, right? It's a national health crisis. And for every single one of those 4 million people, managing their health is a daily, relentless battle. And this little device is what's changing everything. It's called a continuous glucose monitor, or a CGM. It's a small, wearable sensor that basically gives you a 24/7 live stream of your glucose levels. Think of it like having a constant weather report for your body. It replaces all that painful guesswork with actual, life-saving data and, honestly, a new sense of freedom. So here's how we're going to break down this really important story. We'll kick things off with the incredible promise of this technology. Then we'll get into the serious problem of inaccuracy. We're going to explore the high stakes involved, meet the people who are calling for action, and even give you a practical checklist you can use. And finally, we'll look at the path forward. All right, first up, the promise. Because to really get why this is such a big deal, you have to understand just how profoundly life-changing this technology can be when it works right. What this thing offers is, well, it's nothing short of transformative. I mean, imagine going from just guessing what your glucose is doing between meals to having a full 24-hour movie of your body's activity. It means fewer sleepless nights for parents with kids who have diabetes. It means more confidence for adults making those critical decisions about food, exercise, and insulin. It's really about replacing constant anxiety with good, solid information. But, every boom has its dark side. As CGMs have just exploded in popularity, the market's been flooded with all these cheaper, less tested alternatives. And that's where the amazing promise of this technology starts to become a real peril. So, you've got this dilemma. On one side, you have the promise of a healthier, more confident life. But on the other, you have the peril of basing life or death decisions on faulty data. And that's the reality of a market that's just swimming with devices that haven't been properly tested and are making all these unverified claims about how accurate they are. So you might be asking, how is this even possible? Well, the answer is pretty shocking. There are no global safety standards for CGM accuracy. Just let that sink in for a second. For a device that people rely on to make critical health decisions every single day, there's no universal benchmark for safety. It's basically a regulatory black hole, and patients are the ones falling into it. And as Dr. Piotti points out here, this isn't just a tech problem, it's an equity problem. When the proven, reliable devices cost a fortune, people are forced to choose between paying that high cost or taking a huge risk on a cheaper, unverified alternative. That's a choice nobody should ever have to make. Now let's see how this builds, because the stakes here, they are not abstract. We're talking about real physical harm. This is all about why a few percentage points of accuracy can literally be the difference between life and death. Kirsten DeClercq from SA Diabetes Advocacy offers this really powerful analogy that just illustrates the point perfectly. We demand rigorous safety testing for our cars. You wouldn't get behind the wheel of a car that hadn't been through crash tests and inspections, right? So why on earth would we accept a lower standard for a device that's supposed to be navigating our metabolism? A single bad number can have absolutely devastating consequences. If a device tells you your blood sugar is normal when it's actually dangerously low, you could face severe hypoglycaemia, which can lead to seizures or even a coma. And on the flip side, if it misses a huge spike, you could develop something called diabetic ketoacidosis, or DKA, a really serious condition where your blood becomes acidic. It's a medical emergency that can be fatal. These aren't just risks, they're preventable tragedies. But in the face of this huge challenge, a really powerful movement has emerged. A coalition of diabetes organizations in South Africa is stepping right into this regulatory vacuum, and they are demanding change, not just for themselves, but for all 4 million people affected. And this is what makes their fight so powerful. It's not just one group, it's the entire diabetes community. You have patients, doctors, researchers, advocates, all of them standing together.
And when everyone from the person living with diabetes every day to the country's top specialists are all saying the exact same thing, that's a voice that's impossible to ignore. Their mission is elegantly simple and just incredibly important. First, make sure everyone who needs a CGM can actually get one. It should be a standard part of care, not some luxury. But, and this is the key, they are demanding that this expansion of access goes hand in hand with a demand for safety. Access without safety isn't progress, it's just a different kind of risk.
So, while they're fighting for these new standards, this coalition is also empowering people right now. They've endorsed a really practical checklist developed with the diagnostics organization FIND to help anyone, patients, doctors, even the people buying these devices for hospitals, to evaluate them for themselves.
Okay, let's just quickly walk through this checklist. First question, who was actually in the study? You have to make sure the device was tested on people with type 1 diabetes, because their glucose levels can be the most unpredictable. Second, how many people were tested? You need a big enough group for the results to mean anything. Third, was the device tested for its entire wear time? A sensor might be accurate on day 1, but what about day 10 or 14? Fourth, and this one is so important, was it tested at those dangerous highs and lows? That's when you need it to be accurate the most. Fifth, was it tested during rapid changes, like right after a meal? And finally, who published the results? You want to look for independent, peer-reviewed research, not just some company's own marketing brochure. These 6 questions are your shield against unsafe tech.
And all of this brings us to the path forward. This fight in South Africa, it's really a blueprint for how communities everywhere can demand better, safer healthcare technology in this rapidly changing world.
So the whole thing really comes down to this one single powerful statement. Access and safety, they are not opposing goals. They are 2 sides of the exact same coin. True progress means we have to achieve both at the same time.
And this quote from Kirsten de Klerk just says it all, doesn't it? This isn't about asking for a favor or a luxury. This is about demanding a fundamental right to have healthcare that is both available and trustworthy.
Which leaves us with this final, really critical question. As all these new technologies continue to reshape medicine at an incredible pace, who is ultimately responsible for making sure they're safe? Is it the manufacturers, the government regulators, or does that responsibility fall to organized, informed patients and doctors to hold the entire system accountable? It's a question South Africa is tackling head-on, and honestly, it's one we'll all have to answer.